Hi, my name is Hannah and I'm a co-founder of CovidSMS. I moved to Baltimore 4 years ago, and as a student, I started volunteering at the help desk of a low-income clinic. During each of my shifts, I meet people experiencing homelessness and members of low-income communities. During the early months of the pandemic, I met Mark, an individual who had recently been laid off from his custodial job, evicted from his home, and was currently living on the streets. His laptop had been recently stolen and he had no access to the internet, which meant that he had no access to COVID-19 information. He didn't know what basic COVID symptoms were, like a fever and a sore throat, and he had questions about where to get tested. Without hesitation, I Googled the basic information that he needed to know, and I provided him with an answer in literally a second. Had I not run into Mark, he would have fallen through the cracks without access to technology. Any question that you and I have, we easily Google. And that is something that we take for granted each day. But Mark only has a basic flip phone. In fact, 96% of low-income Americans have a cell phone, but only 54% have a computer and 56% have internet access. At CovidSMS, we strive to help low-income Americans access not only COVID-19 information, but also essential resources through the most accessible form of communication, which we believe is text messaging. CovidSMS is a free-to-use, text-based platform that allows anyone in the United States to receive zip code-specific resources. Centered on a mission to serve, we heard from community leaders and city officials about what they needed, whether that be resources, testing sites, and now even vaccination information. Our team works to customize these phone numbers with novel features, so let's see it in action. Let's say Mark was looking for a testing site near him, and as a client at the local resource center in Baltimore, he would text START to their customized phone number. He would then pick English by texting A and then go on to enter his 5-digit zip code. Mark can text B to subscribe to receive COVID-19 statistics every day. This is available for all zip codes across the nation. He can trust that these statistics are accurate because they come right from the Johns Hopkins Center for Systems Science and Engineering and the LA County Department of Public Health. If Mark also wanted to find a testing site near him, he can text E, and a list of testing sites in his zip code would be automatically generated from our existing database of nearby facilities. Let's say that Mark was a client at this resource center and also wanted to subscribe to their announcements. He could text C to subscribe. It's also easy to use on the side of the community leader. They just type out the announcement and schedule what time they want it to be sent out. We have even integrated this service to Google Forms and to Google Sheets, making it as simple and easy to use as possible. From Mark's point of view, he would automatically receive the announcement sent by the community leader. We have additional customizable features that allow partners to utilize our service even beyond the pandemic. This way, clients can access other crucial resources like mental health resources, rent assistance, and even unemployment information. Finally, CovidSMS is easily scalable. We are currently growing at about 6% a month, and we are now sending out more than 34,000 messages a month across more than 2,500 users. These users are coming from dozens of partnerships that we have made with public, private, and government entities. Currently, we have 4 new partnerships in the pipeline, meaning that our demand will increase exponentially. To meet the scale for the estimated 100,000 new users that will use our services for the remainder of the year, we are looking to raise funds to subsidize the cost of these texts to ensure that people can continue to receive information reliably and instantaneously. With $50,000, we will offset the cost of the texts and improve the development of our tech infrastructure. We will also be able to expand our services to other smaller organizations who have reached out to us and are looking for a change in accessible communication during this critical time. Years from now, even when we're able to look back at the pandemic, knowing that it's long over, we believe that our long-standing mission remains the same. With the world depending on reliable and accessible communication more than ever, it will still be our goal to serve our community to decrease the technology gap. Thank you.